Welcome to Land Forces Headquarters in Bombo. I'm thrilled to take you on a tour of the incredible projects completed by the UPDF Engineering Brigade. First, we have the stunning saluting base, a symbol of discipline and pride for the UPDF.
The construction of accommodation for soldiers. We had 5 blocks. Also did the construction of the saluting dice. That's a saluting base.
These impressive structures showcase the engineering prowess of the UPDF Engineering Brigade.
I'm happy to receive you here in Bombo, Joint Service Headquarter Brigade Group. I'm Brigadier General Hassan Chimboa. I'm the Adjutant Joint Service Brigade Headquarter. I'm going to enlighten you or to take you around the projects of the Engineering Brigade in this barracks. I'll concentrate mostly on the barracks where I live. These projects kicked off mainly in 2021 when the current CDF was the CLF here. And those projects have been going on even when he left up to date. So there are some projects which have been so far completed and some other ones are still going on. I can mention some of them. We have, immediately you enter the quarter guard, we have a saluting base which was constructed and finished. We also have a 5-kilometer perimeter fence. It was also completed. We have an oxygen plant in our hospital here, which is also complete. We have accommodation flats for the officers and men. Some were completed, some they are still constructing, and other constructions which are still going on, carried out by Engineering Brigade. There is also a school, primary school. They have renovated it. We call it a round school, a Bombo. They have also completed it. So those are some of the projects which have been carried out. Before I forget, there is also a major project of our water reservoir. We have 4 major tanks here with the capacity of more than 200,000. When he came here, we had only 1 working, but he worked on the 4 tanks, and they are all now functioning and repairing our source of water in Namaliga.
UPDF Engineering Brigade also constructed the fence surrounding the military headquarters, providing security and privacy for the officers. The fence is not only functional, but also adds to the aesthetic appeal of the headquarters.
Lieutenant Silver Olupot, the site engineer for the following projects here at Land Force Headquarters, Bombo. I have here the following projects. 1, the renovation of the officers' mess. As you can see behind me here, I did also the construction of accommodation for soldiers. We had 5 blocks. Also did the construction of the saluting dice. That's a saluting base. we shall see it. Also did the fencing of the officers' flats here at Land Force Headquarters Bombo. Basically, where I am here is a site for the renovation of the officers' mess. The scope of work here was the construction of the mess itself, the construction of the lounge, the construction and renovation of the boys' quarter, construction of external toilets, and the fencing the facility. Basically, we didn't have much challenges with the project, except a few, like the weather patterns, which hampered sometimes the delivery of materials on site, and the setting of our concrete when we were doing concrete works. We also had challenges to do with the price fluctuations of materials, because by the time we did the bills of quantities, the material cost was low. So by the time we began the construction, the prices had shot up. So we had those few challenges. Basically to do with our manpower, the workmanship here. We employ 90% as soldiers, then 10% we use our neighbors, the Wananchi, the civilian community around, to assist us, because we have to partner up with them during our construction. To do with the materials, we use very quality materials on the site, and most of the materials we buy them locally around our communities around here, so that we have that partnership with the local community around, so that we come up with something tangible and physical, as you may see from the background. So basically, that's the brief I can say. We are done with the fencing. We are now left with the compound design. As you can see, we are now planting the grass, flowers, the greenery basically. But the works are done. These construction works were done within 4 months.
UPDF Engineering Brigade constructed a beautiful officers' mess where officers can relax and unwind after a long day. This building is a hub of activity and a testament to the brigade's attention to detail. The UPDF Engineering Brigade has also built several other structures, including officers' housing units, the renovation of the officers' mess, construction of 5 blocks of accommodation for soldiers, saluting base, fencing of the officers' flats, and recreational facilities.
I want also to thank the top leadership of the military, especially the CDF, who has kicked off so many projects in UPDF to help the troops in their day-to-day activities. He has worked on accommodation, he has worked on security, perimeter fences, he has worked on the hospital, he has worked on all other sectors where you may needs be. So we thank him for the good work, but also the Commander-in-Chief, because everything comes from the Commander-in-Chief. Is the organizer, is the manager, is the person who guides whatever we do. So we thank him, and we are looking forward to do whatever he tells us and to add more what we can. Thank you.
Additionally, the Bombo Military General Hospital has significantly increased its oxygen production capacity, capable of supplying oxygen to health facilities in neighboring Luero districts.
The hospital is for all of us. As we know that UPDF, we are here to protect the people and their property. So you cannot protect people who are sick and who are dead. That means you have failed your work. The hospital serves the army and the civilians as well at the same level. We don't segregate.
This boost in production was made possible through the construction of a new oxygen plant by the Uganda People's Defence Forces Engineering Brigade.
Colonel Dr. Oiko Ambrose are my names. I'm the director of this facility, which is referred to as the General Military Hospital, but now actually being called the Land Forces Hospital, Bombo. It is one of the biggest facilities that we have so far for the management of UPDF troops. But on top of taking care of the UPDF troops, it will be surprising when you get to know that over 80% of the patients that we see are actually non-uniformed patients. Of course, these are our brothers, our sisters, our mothers, and our fathers. But this comes with direct implications on the kind of burden that we have to take care of. If I have to look at in terms of infrastructure, whereas maybe we thought we would be able to handle, it is a 250 bed, but on average we are seeing over 300 patients on daily basis here. And that has put a lot of strain on us. I would want to say that because of the support from the Ministry of Health, we have been able to address some of the challenges that we've been facing. Of late, Ministry of Health has helped us to put up an oxygen plant, which is able to fill about 150 cylinders every day. This has helped us to really take care of our patients in both the pediatric wards, in the maternity, in theater, and it has saved us from the usual transports that we used to always engage in, running all the time up to Namamve to pick oxygen. These days we are able to pick oxygen from our plant. Of course, this was made possible by the UPDF Engineering Brigade personnel who worked on that machine, on that project. Also, second to that was the improvement on our theater. There was remodeling and expansion of the theater, still through the support of Ministry of Health and with the use of the personnel from Engineering Brigade. It is not enough, but I would say it has saved us from a lot of trouble and helped us to improve on the quality of care.
My name is Warrant Officer 1 Kasol Stephen. I'm working as the project engineer for the projects which are around, which include the ICU, the oxygen plant, and the remodeling and extension of the theater. These projects, some were funded by Ministry of Health, and these projects include the ICU and the oxygen plant. Basically, the projects which are ongoing when we look at the oxygen plant, it was phased in 3 phases, where we had the civil works, that is the construction of the structure, and the electrical and the mechanical. Then the part of the second phase included the fixing of the oxygen plant, which is now already working. Then the third phase we are working on is to put a generator, a standby generator, to support the hydropower supply. The extension of the theater, which is behind me, we remodeled inside the theater and added on the 3 rooms which were the theater. We added on, and now there are 5 theaters. Then we extended it to remove the data room inside, and we moved an extension to provide the data room outside, and then the facelift on it, as you can see. Then the ICU, we provide 5 pendants in the ICU, thanks to the Ministry of Health, which supported us on that. The challenges so far, we didn't find much challenge. However, during the time of construction, because oxygen plant was a new construction, we had a lot of challenges with cutting and reducing the levels, having found that the slope was slow, the ground was slopy, so we had to cut, and thereafter it rained heavily, which delayed our works. However, we managed to succeed, and the oxygen plant is working.
Bombo Military Hospital stands as a notable health institution in the army, recognized for its extensive medical services. The hospital plays a crucial role in providing health care not only to the members of the Uganda People's Defense Forces, but also to the civilian community.
So the hospital does not only treat people from Bombo, but all over the country, because we have the best services in the region, and people normally flock and come for treatment. As I'm speaking now, we have a good number of patients, both who come as outpatients and those who are admitted in our hospital. We all work on them, and we give them free medication, no pay, and if someone we cannot manage, we give those people free transport to the higher hospital than ours here. So that's how we perform. The Engineering Brigade has been doing a wonderful job. We have to commend it, and I think it is one of the companies, I can call it companies, construction company, which is more reliable than any other. Because if you give them a task, they look at the task and they make sure that they accomplish it at a given time and of quality. So we commend them, and I think if there is any other project which should be carried out in Uganda, we should always don't forget the Engineering Brigade.
The hospital director, Colonel Oyiko Ambrose, highlighted the significance of oxygen supply that has eased the burden on patients and established the hospital as the main medical support hub.
The plan of Ministry of Health was that every regional hospital would be able to serve the lower health facilities in the area that they are located in. So we are supposed to be supplying all the health facilities in the general area of Luwero. We are like a month operational now. Most of the facilities haven't yet started picking that oxygen, but as we talk, we shall be able to supply them with this oxygen with time. Capacity to share the oxygen and support them in case they need the oxygen. We have that capacity, because if we are producing 150 cylinders of 72 CLs, we should be able to share it with them. That capacity is there. We always say diseases don't know boundaries. Whether you're a soldier or you are not a soldier, a disease will get you. So our facilities too, we don't have any restrictions to access. As long as you are sick, you can access our facility 24/7. We do not make any segregation on whether you are uniformed or not uniformed.
During the expansion of the facility, which has been built by the engineers, how has it impacted the community?
One, if you visited our theater before the remodeling and the expansion, you would have noticed that we had only 3 operational beds. But as we talk now, we are able to do 5 operations concurrently. So we're able to create space where we put 2 more operational beds. So in terms of improvement on quality of care, yes, we are now able to do 5 concurrent operations at the same time, which is a benefit both to our communities and even to us, the staffs.
The 250-bed capacity is committed to offering free medical services, distinguishing it from private healthcare facilities in Luwero district. Bombo Military Hospital generates over 120 oxygen cylinders per day, providing a reliable and constant supply of oxygen for patients in neighboring health facilities.
Numbers have always kept going up, and I don't see them going down. I do not have reasons as to why but you'll be surprised that people come here all the way from Nakasongola, people come here all the way from Mukono, people come here all the way from Lira, and yes, these numbers are big, and they put a lot of strain on the resources that are available. We cannot say we are overwhelmed, or we can't handle them, but it is something that we always have to find ways of addressing. As you move around, you'll realize we are trying to renovate some of our wards, and we are trying to put in place new wards to take care of the big numbers of the patients that we receive.
The quality is good. So they are doing a wonderful job, and I commend the wise leadership of Mzee for having noticed it early enough. Sincerely, when you look around our country, it's only the foreign companies which can do quality work. We must develop our own companies to do such work. And Mzee, I think, thought it fit to look at the UPDF to do it. But I also request that we expand it more, so that it does not only work in the military, to also help civilians, as they did in Nambole the other time.
The doctors in Mulago, the doctors in Bombo, the doctors you find in Soroti, we are all the same doctors. But probably the environments that we work in are the ones that differ. And probably that has a bearing as to where the patients choose to seek care from. Whereas we may be facing similar challenges like those other facilities also out there, the way we seem to be addressing them probably is making the patients to prefer to come here. We have all been hearing about patients getting charged for services, patients complaining of lack of drugs. Those complaints, even here we face them, but we try to make sure that whatever is available, the patient benefits from it.
The experience we have to learn, or we learn, is that if you have a force which is committed and with good leadership, everything can be done so swiftly. That's what I can say. The funding is there, the leadership is there, and the people who are doing the work are committed. With guidelines, work will be done very fast.
When you visit the site, you will get the answer yourself. The facilities are good, and these are things that were put up in, like the remodeling and completion of the theater. I would say it was done in record time. One, why? Because first of all, the pressure was there. We could not completely suspend the services that were being offered in theater. Within such a short time, they were able to accommodate all the concerns that we needed, and they remodeled the theater to our satisfaction. We are comfortable with what they did, and we feel that was relatively very good work from their side. I bet if you visited us maybe after some other 5 years, you'll find those structures still standing, and it will be a testimony to the work that they have done.
Each building is a testament to the brigade's skill and dedication to their craft. The UPDF Engineering Brigade has truly transformed the face of Land Forces headquarters in Bombo, and we can't wait to see what other projects they have in store.